Hey everybody, I'm Dr. Kraft. I'm the MCHC's chiropractor and I'm located in the Whitesburg location. I'm here to talk to you a little bit about what chiropractic is and how it can benefit you as a patient. Chiropractic is a newer field here with MCHC, and so I wanted to kind of break it down for you to a little bit be more understanding for you. Chiropractic is a field in healthcare where we focus on the spine and the muscles and ligaments around it. Sometimes the spine can feel tight and restrictive, and what we call those things are subluxations. A huge word for a small little point that happens when the bones shift left and right and kind of give you those pain moments that you're feeling. In chiropractic, we focus on removing those pain moments for you, stretching those muscles out, stretching those ligaments out for you so that you feel better along the way. Now, how can it benefit you overall? A couple of different things. So in chiropractic, we can focus on everybody from infants all the way to our senior age. So infants, how they benefit from it. Infants can benefit from chiropractic because they focus on coming out, of course, of the womb is a very traumatic experience for that infant. The spine can be twisted, turned different ways as the birthing process happens. And when this comes about, all those twisting and torsions can cause spinal issues, can cause anything from ear issues, colic, not being able to sleep well or attach well to the mother. And all these things are things that we focus on in chiropractic to help make sure that spine is aligned so that the body can communicate fully. Now with kids, how does it help with kids? Your kids are going to school every day, they're falling down, they're tumbling down, they can carry these big huge backpacks that have all kinds of stuff in them, their books, their Chromebooks now. All this weight on that spine can help pull different areas of the spine, and that can shift the spine a little bit, causing those aches and pains that they're feeling. As chiropractors, we go in, make sure that their spine is aligned, and those aches and pains can be relieved for you. Now, as we go into our adulthood a little bit more, we have our jobs that are super stressful on us. All these stressors can help pull the spine a little bit more, cause a little bit more of a pain for us as well. And if we are either sitting for long periods of time at a desk, hunched over at a computer, we're using our hands a lot more, working on equipment, things above us. If we're someone that works in mechanics or a hairdresser that's always working on their right in front of them with their hands up, this can be pulling on that spine and all those muscles. And when that spine gets shifted, we go in as a chiropractor, check, see where it's at, align those bones back where they need to be at, releasing those muscle tensions, and so that you can have that relief. And in our senior age, what happens? Our bones get more brittle, we get a little bit more active and trying to move around because we think you can get from here to there, but it's harder for us as geriatrics to move. And so at geriatric age, we fall. We have these times where we may stumble down the steps, or we may stumble getting up off a couch. When we fall, those shifts happen in the spine, in our hips especially, and when that happens, we can go as chiropractors, find those shifts that happen, align your body back to where it needs to be, and then you can find relief. Now, we also have different other options here at the MCHC office in Whitesburg for chiropractic. We have our TENS units that we can put on our muscles that are super tight, that are pulling, helps the muscles kind of relax, give them a little bit more relief. We also have what we call an intersegmental traction table. When you start as a chiropractic patient at our center, we roll it as the roller bed table. It's a shorter way of saying it. These big, huge rollers come up out of the bed, attach to the spine, and they stretch out the spine and help give you that more relief that way. We also have ultrasound, same very similar thing as they use in radiology, except for we don't come up with an image. Their sound goes into the muscles, helps break up adhesions, also gives the muscles some time to heal, back how they used to be before the injury. And all these things are encompassed here at the chiropractic center. Now, like I said earlier, we try to find what the spine is aligned. I said it was called a subluxation. There's three main things that can cause those subluxations that I talked about. Now we have our thoughts. Thoughts are stressors of everyday life. Like I said before, when we're getting adult, we have a little bit more stress. Thoughts of stressors can pull those muscles and then pull those ligaments and then tendons and then the bones get shifted. That causes that subluxation. Number two is trauma. It could be anything as minor as, like I said, posture issues that we have earlier. Our posture issues are horrible these days. We sit in the chairs and at our desk. Even since COVID has now happened recently, we have a lot of at-home jobs. And so we are at a desk all day long, typing on a computer, talking on a headset. We get this hunched over effect, which then can pull on the spine, like I said earlier, which gives that subluxation to happen. Then we got to go find and fix that out for you. And the third things are toxins. The toxins are a little bit more harder to understand, but it's just anything that we put into our bodies. Eat, breathe, anything we swallow, take. It could be anything as medications to things that we drink and eat. All these things are chemical compounds. And so they interact differently with each person. That's why there's different side effects for different certain things. And so When they get into our bodies, it can cause our muscles to act different ways, which can possibly pull that spine and then causing that subluxation. And then, of course, as chiropractors, we go in, check that subluxation, try and figure out where it's at, and then release it for you. Now, there's phases of care in chiropractic as well. So you come in, say it's day one patient time, you come in, we check you, do your exam and everything, we find that subluxation that's causing that issue, we adjust the spine to fix it. Now, once we adjust it, you feel that relief and you feel great, but that's still phase one of care, that introduction phase, because we have to train the body how to actually hold that adjustment that we just gave you so that you don't go back into how you were before, and train your ergonomics at work, teaching you how to sit better at work. All those different things happen in our phase one so that we can hopefully get your spine back to where it needs to be. And phase two is more restorative care. This is that period of time in our care where we focus a little bit more on exercises, and we focus a little bit more on maneuvers that you can do to help stabilize yourself a little bit more. Once we get through that period of time of our phase of care, we then focus on wellness care. Now, wellness care is usually the end of care. This is usually where we come in every so often, just like you would that you do with the dentist. You come every so often to make sure your teeth are good to go, like you would with the optometrist, the eye doctor, just to make sure that your eyes are good to go. Same concept with chiropractic. We go through everyday lives facing tons and tons of things. Like I said earlier, those thoughts, traumas, and toxins, we can't escape them. They're part of life every day. So as we go through life, we have to also focus on making sure that we can get those things aligned, get our spine aligned, make sure that our body can function properly. Now, if you've ever had an anatomy class before, you know that the brain is the communicator of the whole body. So the brain communicates with that body through the spinal cord, which then goes down into the spine. It then branches out to all the different organs and tissues and cells. So it's not just a one-way communication system, it's a two-way communication system. Our brain tells our cells and organs what to do. Then the cells and organs communicate back with the brain and say, hey, we understand you want us to stretch right now, we'll stretch. You want us to produce this specific type of hormone, we'll produce it. The issue, though, with those subluxations that we talked about earlier, is they create an interference, a nerve interference roadblock between that brain and body communication. So let's say, for example, the brain is going to communicate with a specific cell and tissue that controls a specific secretion of a hormone. So our brain says, okay, hormone, it's time to produce. And so it's going down to the spinal cord, out through the spinal nerve, into that cell, boom, produce. But now it's hit that subluxation of that spine where the spine's twisted a little bit. Now there's a roadblock, and it can't get to where it needs to go to tell it where it needs to function. And so it may be able to get around it some like you would a roadblock. You can go over a log or you can go around a log, but it takes longer to get there sometimes, or it may not do as convenient as it needs to conveniently. And so that specific organ now can't function as optimally and perfectly as it needs to. Now it can't communicate back with the brain as well either because there's that roadblock going back the other way. So that subluxation can cause a lot of different things, more than just pain and tightness. It can cause that body to not function as properly as it needs to. So at chiropractic, we focus on those, removing that subluxation, locating where they're at. We do different types of exams to see where they're coming from. We do different types of tests, orthopedic tests, neurological tests to see if you have any type of nerve issues or any type of muscular issues that are causing from this. And then we focus on that, getting that fixed as quickly as we possibly can. And if it's something out of our wheelhouse, we also always just refer out as much as we need to. So chiropractic is extremely important in everyday life. It's something that you don't just kind of go to every now and then. It's something that becomes part of everyday life because, like I said, those toxins, thoughts, and traumas continually happen every day. There's no way out of experiencing those. So the best thing to do is see the chiropractor as soon as possible, MCHC Whitesburg, and we can get you in as soon as we can.